Rhinoplasty, let's say, it's a kind of brain operation. First of all, the patient comes before the technical part of the operation. Of course, there are some patients who are devastated and where you need to rebuild the whole nose. But this is a small fraction of patients. The majority of revision rhinoplasty patients, they come from, let's say, subtle or medium changes of their noses. What we should offer, I think, is not a fit-all operation, but we have to tailor the operation according to the anatomy and according to their wishes.
Revision rhinoplasty is a challenging type of rhinoplasty, and nowadays 2/3 of my patients are revision cases where we carefully analyze the problem, and this again brings me to the nose and the problem at the level of the shape of the nose as well as at the level of the endonasal state, where we carefully have to evaluate what is the reason for undergoing revision surgery, what is the reason for dissatisfaction of the patient. So we need to understand very well what is the reason for the dissatisfaction after a previous rhinoplasty. If we carefully understand what is actually the reason for dissatisfaction of the patient, and if we think we can improve the nasal state by a revision rhinoplasty, we may provide the patient with all the information that is necessary to envisage a revision rhinoplasty. And there we discuss again with the patient what we would be aiming for, what graft material is needed in order to achieve the best possible rhinoplasty result, and what this patient can be expected. We have performed a couple of academic studies on that topic, which allow us to clearly predict and anticipate the percentage or the likelihood of success of revision rhinoplasty. And there we tell our patient that if it's a primary revision rhinoplasty, the likelihood of them being satisfied after revision rhinoplasty is about 85%. This percentage seems high, and that is indeed a good percentage and reflection of reality, but this percentage may become lower if we see patients also that have had 2, 3, or sometimes even more rhinoplasties in the past.
In revision rhinoplasty, you have to explain the patient, now a lot of tissue has gone, therefore you have to do an exact analysis to tell him where are the limitations of your revision. But in my own cases, I checked and followed all the revision cases we had to do from others. 80% of them, the septum had to be revised. That means the importance of the septum is very much neglected. And therefore, I think everybody who is operating noses must be able to operate each septum, not a very small minor deformity, each septum, because this is the key for everything.